While an organization representing students and staff across South Africa is preparing a class action lawsuit against several public universities over their mandatory vaccine policies. Universities Alliance South Africa is against the vaccine mandates, which have been adopted by several institutions. For more on this, we're joined by CEO of Higher Health, Professor Ramneek Ahluwalia. Professor, thank you so much for your time and thank you for joining us. Your thoughts on these impending legal challenges?
I think, thank you very much and good afternoon to everyone. These are very testing times for South Africa and our sector in general. And there are multi-dimensional things that we have to look into. The first important thing is that we have something which we call not to leave any student behind. And what we mean is access to education is a right of every South African, and it has to be looked into and ensure that every South African has an absolute right to education. And that's what makes such situations more complicated at times. On the other side, we also know we're dealing with a virus which is extremely mutating. As you also have heard that there's a new variant which has just been detected in UK called XE. So that's going to be how the norm of coronavirus will be, considering this virus has now formed a human-to-human nature and is bound to stay with us. And we also know that the only arsenal at this moment we have to defeat this virus is vaccination. Because what we are seeing clearly is that vaccinated people are far more less prone to severity, even though the breakthrough infections happen, or to death. And what we are also seeing in higher education is what we call it as congregation of settings. And in congregation, when you have in-classroom situations like residences, laboratories, libraries, where there's closed dwelling and there's a lot of crowd inside a closed dwelling, the issues of exposure from one human to the other. And the question that comes is the human rights issue, which is vaccinated people say, well, I have been vaccinated, I'm in a congregation to study, should I be mixed with non-vaccinated people? While the non-vaccinated person also has an equal right to say, but this is access to my education and that's my own right. And in that context, in the Higher Education Act, the universities in South Africa have absolute right, as per the Occupational Health and Safety Act or Higher Education Act, as an employer to decide their own mandate around whether they would like to impose vaccination as mandatory or not. But from a sectoral perspective, from higher health and a sectoral perspective, there has been no consideration towards mandatory vaccination. These are the reasons why we have done that. One is, how do we ensure how to make sure every student is accommodated when we know vaccination is important. We have an important angle towards understanding the first years who have just come in and access to vaccination for them. But one thing is for sure, is that vaccination is the only solution at this moment we have in order for us to get our economy back, in order to protect our lives from this mutating coronavirus, and in order for us to get education back into stream, because there's no way we can continue education online. And that inevitable reality has been discussed with our parents to us, students themselves, that it is the time that we cannot, and last 2 years has been difficult. And not only what we are looking at COVID at this moment, we're looking at the psychosocial issues, we're looking at the mental issues, we're looking at the graduate skills issue, competency issues, market issues, which what the private sector, the employer is looking into when these graduates are coming out. So it's a whole skills building issue, which obviously we have seen can work on a hybrid, but not completely online. I can't see myself as a doctor, an engineer just becoming completely trained online. So opening the system is important, and vaccination is an access or a way to open our system. And that's what we find ourselves as a sector. So there's no sectoral policy on mandatory vaccination, but however, we do respect the autonomy of our universities, and they have the decision to make what's right according to their system, the kind of courses they follow, the congregations they have in order to protect their population.
Okay, Professor, thank you so much. We are going to have to leave our conversation there. That's CEO of Higher Health, Professor Ramneek Ahluwalia, talking to us there about that looming deadline for students to get vaccinated in order to access those campuses.